to remind you that there are some giveaways at the table. One, we have some oxygen tubing for anybody who's using oxygen. Please just take as much as you need. I also want to remind you that you each have a survey in your packet. And if you could fill those out before you leave, just give us some comments on today and some suggestions for what you'd like to see next year, and just leave them either on your table or up front here. That would be great. So let's bring Dr. Muller back up. What do you think so far? Good? All right.
Okay. Well, onward. So it's my pleasure to introduce Alexandria Crowe, and we have not known each other before last night, so good to meet you. And she graduated from McMaster University in 2007. For those of you who don't know, McMaster is from the state just to the north of, so it's in Canada. It's from our friends to the north, the Canucks. She graduated from McMaster in 2007 with a Bachelor's of Science in Nursing. And I hasten to add, Canada really has a fabulous scleroderma network. They really do. They have great scleroderma doctors up there. They really do a great job. And they work closely with us in the Scleroderma Clinical Trials Consortium, which is international. And they've really been able to pull together their centers and really understand some aspects of scleroderma well. So with that little aside, she has a Bachelor of Science in Nursing. Immediately following graduation, she began working in the intensive care unit. And in 2011, pursued her Master's of Nursing in Acute Adult Nurse Practitioner Certification from Toronto, the University of Toronto. Today she practices as a nurse practitioner and skin and wound specialist in St. Joseph's Healthcare, Hamilton in Ontario. She's also part-time faculty at McMaster in the School of Nursing and holds an adjunct faculty appointment at the University of Toronto. She's a certified functional medicine practitioner and certified health coach with her private practice, which helps people find the root cause of their conditions and manage their health with an integrated health model. She says she's a bit of a fitness nerd, loves to go trail running with her dog. I didn't learn, what's the breed?
Sorry?
What's the breed of dog?
She's a mutt.
She's a mutt. Okay, so we got that down. You gotta like that part. So with that, I'll let her get started. She's going to speak on skin care and wound management, which for those of you who've had to deal with this know what a difficult issue this really can be in systemic sclerosis and all of our scleroderma patients. I always cringe when I am dealing with this because this really requires a multifactorial approach, and it's not at all easy in many cases, and the wounds can be there for many reasons, including the calcinosis that we've already talked about that we lack good therapies for. So good wound care becomes imperative in that situation. So I'm eager to hear what you have to say.
Thank you everyone for coming out. Thank you Dr. Mulder, and thank you Dr. McCall. Not only was she a great introduction, and she went over actually some stuff that I was going to, so now we can fast track to some exciting nitty-gritty stuff. But she was also my ride here this morning from the hotel, so thank you. And also thank you to Jane. Where is she at? Where's she going? There she is, she's in the back. So Jane was wonderful enough to reach out to me in the north, which is funny actually because I am south of here, so where is that? So thank you for reaching out and giving me the opportunity to come down and talk to you guys. I've talked to a few groups on this topic, similarly in different areas. I was able actually to talk to a few groups like this. I'm going to have a good time today about this particular topic, and I've been learning from you guys even as we go, and I find a lot of the time at the end when questions come up about specific things, if anything, I find that the feedback from each other and the support given back and forth between people's experiences can sometimes be even bigger pearls than anything else. So please kind of, at the end, if you feel like, oh, something really worked for me, please, because a lot of the times I learn from patients as well who come in to see me about what they've done, what works for them, and sometimes that's where I get some of my pearls of wisdom is actually from you guys who are living it day to day. So with that, on we go. I also have this wonderful pair of fuzzy warm gloves up here because this morning was chilly. And somehow throughout this presentation, I'm going to try to figure out how to give these away in a reasonable way. So, a question of some kind, or if you, an answer if I throw it out there, they could be yours. Okay. So don't fall asleep. I know I'm right before lunch, and it's always a very promiscuous place to be. So we'll try to get through this and give out some beautiful gloves. Also to that point, as Dr. Mulliner went over, I am a functional medicine practitioner, so I do a lot of integrated health as well. So I might end up touching on a little bit more of that as we go, so if you have any questions about that, also, I'll be here for lunch over if you want to talk about anything in that respect. But really, I look at the skin as an organ. I think a lot of times we think of our skin as this beautiful casing to all of our internal important organs, but the skin is our largest organ of the body, and it holds a lot of functions, and it does have its own kind of considerations when it comes to immune system, circulation, things like that, and it's all interconnected. So I think if we just kind of going into this, keep in mind that the skin itself is an organ, and so that's just my organ of choice that I specialize in. Okay, so I was going to go through kind of what's going on in the skin, but I think, again, Dr. McCall went through a great kind of explanation of that, going through the different phases, so I'll probably breeze through that quickly unless anyone has any objectives. You can, beautiful. Kind of what you guys can do on a day-to-day basis, it's really what you guys do day-to-day that makes the most, a very significant impact as to how things are going to progress for you. Every little thing from what you're putting on your skin from day to day, what you're doing day to day, what you're eating day to day, all of that does cumulatively add up. How many hours of sleep you get day to day. All of that does start to add up to what's going on and what your outlook may be down the road. And then what are some of the things, I'll throw in as well, what are some of the things that our doctors do? I'm part of I work collaboratively very closely with rheumatologists in the cases of patients who have any connective tissue disorders, because a lot of them do result in skin breakdown and wounds over time. So I work very closely with them, and they do a lot of the management, the medical management of things, but there are going to be some, I'm not sure. Oh, you know what, you're right. Okay, I have to remember to do that. Thank you. Nice and early. So much to think about. So, and then lastly will be kind of focusing on the considerations that when I have a patient who has scleroderma or any other connective tissue disorder, and I'm looking at they have a wound, how to approach it, how it's different from, say, if I got a wound or if I had surgery, and the healing process that my body's going to go through, what are the considerations that are a little different for someone with scleroderma, whether it would be the diffuse, limited, all of them generally, how it's affecting the outcomes and what we keep in mind. So again, just to give a quick review, kind of the phase 1, and this is a general overview of how things kind of go through. Some of you may be in this phase with having the puppy fingers, eventually to get incredibly itchy from what I have heard from some of their patients, the patients that come in. This is kind of the precursor that comes in before the thickening of the skin happens over time from this phenomenon sustaining for periods of time. It's a lot of the time it's the really intense itching. I find sometimes just over-the-counter Benadryl in some instances, or a low, like a 0.1 a 1 or a 0.5% hydrocortisone. In Canada, we can get that over the counter. Down here, you guys are good too? Yeah, just checking. Just something like that, just to put on topically, not go to town with, but it should give a little bit twice a day with the topical steroids, just to kind of bring down that itching just a little bit. Moving into the thickening phase of things, a lot of times, again, if it's the limited, it will be more the hands and arms and feet and the face. If it's diffuse, it will be affecting throughout the body. It can also impact hair growth and sweat glands, as well as you'll see some of the fine line and the very pursed lips that will come with this because of how it works and affects the skin around the lips. And then the third one being the atrophic. Just making sure I'm on the right one. Where in some instances the skin itself will actually start to soften At some instances, we'll start to see those little spider veins come up, sometimes on the hands, sometimes on the face, tend to be where I see them, where patients come in with them the most. The calcinosis, again, can be on the fingers. I do go over that just a wee bit more towards the end of the presentation as well, with some additional considerations for just kind of what I end up being involved with my patients that come in with that. The ulcers that do come up over time, the digital ulcers secondary to the Raynaud's. Sometimes you'll see the hyper or hypo, so the skin will get either a little darker or a little lighter with time as the skin changes progress. And then you'll also get some of the itching, which can become very severe. I know we're giving out like the back scratchers, so I'm assuming that's something that's, I can just look around and kind of figure out who at the table has that. So, okay. This, I had in there, again, this was just kind of to say there is an organized kind of approach that when we look at someone who has skin concerns that we will look to. Again, to the points that were made, physiotherapy, especially for when the skin is thickening, especially over joints, very important, not only for the skin care itself at that joint, but then the physiotherapy, keeping it active, keeping it the range of motion as much as we possibly can for as long as we can to reduce those limitations as time goes on. So the skincare part of things. So one thing, and I guess everyone can appreciate it here in Minnesota as much as I can over in Ontario, about our limited amount of vitamin D exposure and how much we're willing to put our full bodies out in the sun all year long. With this, however, there have been instances where photophobia or phototherapy, UVA especially, so when we think about the sun, there's UVB and there's UVA. UVB only goes down into a few layers of the skin, where the UVA actually goes deeper in. When we start talking about risk for skin cancer and things like that, they're more concerned about the UVA because it does go deeper. The phototherapy is very targeted. It's only good though for the skin involvement because it only goes down to that layer of skin. It doesn't go into the muscle, so we're not going to be relieving any symptoms and collagen buildup at that point because of that. But if, as an adjunct, as an additional, I've had several patients who have had good outcomes when it's come to the phototherapy. It's ultraviolet, it's increased, what it does is actually it increases the enzymes in your skin itself that breaks down the collagen. So when we think, pretty much my kind of rule of thumb is anything that, as society we say, is going to age your skin, someone with scleroderma is probably one to embrace. Because what we're trying to do, the anti-aging and anti-wrinkling goes to our bodies naturally over time will reduce the amount of collagen we have, therefore you end up with the wrinkling over time. With scleroderma, the trouble is that the collagen is too thick. So anything that we're doing to our skins and to our bodies that's promoting collagen is counterintuitive to kind of what your goals are. So if anything, that was kind of like an aha moment for me, was kind of anything that's limited or labeled as anti-aging is probably great for you guys. And vice versa. So anything that's considered anti-aging, so when I talk about creams and things like that a little bit down the road in the presentation, so anything that's anti-aging, to be very careful of when you apply it to your skin, because a lot of the time the aim for those is to increase the collagen in your tissue. So keeping that in mind. But onwards we go. So the ultraviolet light increases the enzymes that actually break down the collagen in the skin and decreases the enzymes that trigger more additional collagen production. So that's why the targeted UVA therapy works really well. There are considerations to this. You might get an actual second-degree burn while you're under there because you are under intense sunlight for stretches of time. It is a therapeutic set amount, so it's not putting you at a great risk, but sometimes we get a little bit of redness, you get this first or second degree burns. Usually, I think I've only had one instance where someone's had a second degree, and it's because they were also on steroids, which puts you at greater risk for burning. So if you are on those, we try to keep that in consideration. That's something to share before, if that's a therapy you want to go forward with, to just let them know they might dial back the amount of time that you're exposed. The other thing is if you have herpes simplex, it can possibly recur in the skin at that point if that's an area. So usually on the back, things like that. And then accelerating aging in the sense that you might have a little bit more of that leathery appreciation if we do this for longer stretches of time. But usually, again, it's only about an 8-week treatment where we see the most benefit, and after that it's more of a maintenance, a weekly, every 2 weeks, once the skin has softened up a bit. So with 15-minute treatments, about 5 times a week for 8 weeks, in addition to, again, if you're on any medical management, that way we don't discontinue that while you're on this, going for the UVA, it's in complement to. There were visual changes in the tightness, itchiness, and significant decreases, including on ultrasound, noticing that there was a decrease in the thickness of the skin. So this is one of those, again, just additional therapies available. That being said, when you have the 3 beautiful months of the year where we can actually lay out in the sun and allow giving yourself, that 10-15 minutes, and this is without sunblock on. If you are on steroids, limit it to about 10 minutes, but if you're not, laying out and giving yourself some exposure to the sun, not only is it great for your vitamin D, which I might talk about a little bit later, but it also then allows for this UVA permeation, just to the point where you're going to see some benefit. It's not as clinical, and well controlled. You get a cloud over and poof, there goes half your therapy. But in the sense that it's free, it's there, and it certainly does have those benefits to it. Other therapies that we've found some benefit in, especially with the early onset with the scleroderma and the puffiness in the hands, the swelling, is the paraffin wax. Has anybody ever tried paraffin wax on their hands?
Yep.
Did you love it?
Yeah.
Right. We actually, I was told to remind you guys, we're actually got a few coming later today, I believe, to be part of the raffle. So make sure that you guys go out and take advantage of that opportunity, because I love paraffin wax just because it does feel wonderful on my hands. The reason that it's so great, especially in the scleroderma hand, is because it will dilate and allow and open some of those blood vessels a little bit more, allowing for that blood flow to get through the tissue. So if you have open sores, however, not a good time. Wait until your sores are closed. Don't dip into hot wax if you have open wounds. However, if everything's just very tight and circulation is an issue, put it in. If you're coming in out of a really, really cold day and your hands are very, very cold, I would not, because of the extreme temperature change, put them right into hot wax. Let them warm up to room temperature before putting it in. I had a patient who did that. It did not go well. So, she ended up with a necrotic digit on her finger because it was too extreme. She almost had like the rewarming of frostbite. So that's certainly not what we're going for. So let it warm up if you're going to go this route. While your hands are in the wax, also because we were talking about hand physio and movements and things earlier, because it brings down a little bit of inflammation and you're increasing the circulation, move while you're in there. If you have a pot that you can actually move them in, because you'll get a little bit more of that range of motion. It'll feel really nice, especially on those joints. The heat on your joints will feel really nice. You might get a little bit more of that ability to stretch while you're in there, so take advantage of it. All right, so usually they saw the best results to do it daily after about 30 days, and with decrease in the swelling, increase in circulation, and less kind of flare-ups of the Raynaud's component of things. The other one, if you have a really good physiotherapist or occupational therapist that you're working with, these are usually more technologies that I'll go to if we have a wound that's not healing, and I know it's probably because it's more related to the circulation of the larger vessels in the arm, but pneumatic compression devices, which is a big fancy word for a sleeve that will blow up with air and kind of squeeze and give you a massage. That's ultimately what it is. It'll give you a lovely arm massage, but that lovely arm massage is going to help move that circulation again up and down your extremity to allow for maybe where gravity may not have had ideal on its own. This kind of gives you that extra little bump to increase getting the circulation down and back through your arm. Again, this is like an extreme case with 5 hours a day, demonstrating, however, that there was a 96% ulcer healing rate after 25 weeks. So if there's really, really stubborn wounds on the hand, either the fingers or anywhere else on the hand, it really does significantly improve those outcomes in patients who are having trouble, and they're able to then return back to a quality of life where they can use and remain their quality function again. All right, creams, because some people are like, yes, what do I put on? What do I not put on? What feels good? So, emollient creams. These are your really thick creams. These are the ones that usually you put on at night before you go to bed, or you put a glove on over top. Or for me, if my feet get really, dry in the winter, I will put socks on after I put this on, because I will slip and slide around the house if I try to walk around after putting it on. So this is anything that's got mineral oil, petroleum, or Vaseline as a base. These are great for your skin, and I've got a lovely picture later to show kind of the layers of the skin and what happens when the cells start to dry out. Emollient creams are non-cosmetic. They're usually ointments, lotions, or gels, depending on what term they use. Ointment is always going to be your thick layer of things. It's going to be that slather on kind of goodness. As you get to creams and lotions, they tend to kind of cut these with water, so there's not as much of that heavy emollient in it. You tend to get more of something you put on and it feels good for a bit, but it tends to dry very quickly. Again, great if you're at the office all day and you're literally all day putting stuff on your hands. You don't want them to be greasy as the day goes on, but you get that benefit, but at the same time, you don't get the same effect from it. You have to keep reapplying. It has in a lot of instances, and again, I'll show you in a second, I'm a very visual person, so it helps in a second to see how it looks. But as your skin stays well hydrated, it'll be more, it's better protected from the elements outside. And I'll show you kind of how the nerves are less irritated in skin that's more well hydrated. That also then comes to the hydration, internal hydration. How many of you guys drink at least 1.5 liters of water a day? Okay, for those of you who don't, unless there is a reason related to kidney function, that you have a restriction that way, trying to get that 1.5 liters of fluid in a day can actually go quite a long way with your skin. If you think about, we always talk, even in the general kind of, in the cosmetic world would be, beautiful skin, stay well hydrated. If you're like, everyone, I love it, everyone's picking up their water bottles, everybody take a sip. It's a wedding, everybody take a sip. So if you can get 3 water bottles in a day, if you're not getting in 3 water bottles a day, you are doing your skin and your whole body, your immune system as a whole, which is trying to balance itself as well as it can. You are not doing it any favors. Please help it along a little bit and drink at least 1 liter of water a day. That does not include coffee, teas, and juices, do not count. It has to be straight water. Because there's sugars and other stuff in there. Okay. So that's my functional medicine hat. I'm going to put that back over here. Okay. The other thing too is moist, well-hydrated skin is less likely to crack. Especially as we go into the winter months and everything gets really dry. In addition to that, the well-hydrated skin is not going to crack as easily when it's being used. Okay. On to hydroxyethyl urea, sir? There you go. So this is in your things like your Urmel creams and your Eucerin. These ones will help to take the itch down in the skin quite a bit. And you can keep lathering those on as long as you like. You can probably get them at local Walgreens, any of those. We have Shoppers Drug Mart in Canada. I guess Target would probably be also a good one. What it does is it will soften the skin a little bit. It promotes the pH balance and your acid mantle, which I believe are the next slides, and that's where everything kind of makes sense from a visual point of view. It offers a little bit of a local anesthetic, so it helps to kind of numb the pain just a wee bit. And it also, again, it'll add for that moisturizing for that really dry skin. So if you're gonna go out and buy anything from today, and I don't have any stocks, sadly, in Eucerin, but I would recommend something like that be on your gambit. So pH balanced products. So this is one of those things, in some instances, I think as a whole, the skin care and cosmetic world is getting a little lot more on board with what they're saying is and isn't in their stuff, whether it's paraben-free, phthalate-free, all of these things. One of the big, if you can find something that's pH balanced, the skin itself actually sits a little on the acidic side at about a pH, does anyone know what like the pH of water is? 7. Beautiful. So that's like dead, middle, neutral. You start to go, the numbers get a little lower, you get acidic. You got like stomach acid is like 2. And then you get really high and you end up with like things like lye, which is very basic and alkaline. Your skin sits very, very happy at a 5.5. With that 5.5, it actually allows for the cells to function properly. It allows your body to actually shield itself from bacteria and environmental toxins. So if you have very, very sensitive skin to different ointments and creams and other things, detergents, if you find you're having a really tough time with some of those, it could be a number of things, but one of the things could be that your acid mantle is out of whack. And because of that, and there are little things that we can do on a day-to-day that will help with this. A good moisturizer, something like, again, your Eucerin that's pH balanced and will bring your skin back to that. If you have a shower, water being a 7, you're already actually bringing it a little bit out of its comfort zone. So to bring it back, something like a pH balanced cream to help with that. Whoops. Oh, what did I do? Oh, okay. Next presenter, don't push this button on the bottom. Okay. So, your pH, your skin when it's happy. Okay, good. Your skin when it's happy, all your cells are well organized. It's able to repel anything that's kind of coming at it, whether it's anything chemical-wise, toxins, that kind of thing, or viruses and bacteria. That well-organized skin level will help to keep the moisture in and keep all of that stuff out. Again, this is one of those major functions of your body, your skin, is to act as a buffer to the outside world before it's allowed to get in. From there, it also keeps moisture in. It allows to keep the moisture where it's supposed to be. It also keeps the nerves where they're supposed to be. So, when you end up over here where things are disorganized, the moisture is much more easily able to leave the skin, therefore drying out faster, cracking easier. Things are able to get in, but those nerves actually migrate up to the surface and are more sensitive to things that they will actually come in contact with. So if you're already having trouble with sensitive skin, dryness, this is why when skin gets drier, it gets more sensitive. It's kind of a double whammy. So anything that you guys can do, because of how the scleroderma changes the skin in time, you still have control over that epidermal layer and how well it's functioning with what you're, again, doing from day to day. All right. So what to avoid in creams? Now, to this point, there are prescription retinol and vitamin A. There is supplements that we will give with vitamin A. However, the stuff that's in over-the-counter, say like, oh geez, why is it not coming to it? Like a Clinique, and I'm not picking out a Clinique, the Oil of Olay, or anything that has all of these things for anti-aging. As pointed out earlier, the FDA doesn't manage and regulate some of this stuff as well, so you don't know what kind of form of the vitamin A that's going in there. You don't know how much is going to be in every application that you have. And over time, it can actually confuse your skin a bit more if it's not an actual tight prescription of what you're getting. So in some instances, I will prescribe vitamin A or vitamin A ointments, but it needs to be that form that's pharmaceutical grade that we put on in a prescription way, as opposed to, I'm gonna get some L'Oreal, I'm gonna smear it on my face, I'm gonna go from there. So keeping in mind what it is, making those choices. Because of everything that's going on in the skin, you guys have to like up your label reading just that much more to double check what it is that you're actually putting on, and is it causing more grief than as benign as you may think it is. Well, I'm just putting some cream on my face, it's okay. That label reading is very important for a lot of what your skin health has going on. The other thing, vitamin C, again, fantastic, and I'll actually talk about it and the role it has in wound healing later, but not, again, if it's in a prescription form. I know flu season's coming up, people are going to be like, I need to take some vitamin C. Keep in mind not to take any more than 1,000 milligrams a day, in that sense. Alpha hydroxys, again, it's another one that's been linked closely to anti-aging, also another one. Good in a prescription form, not so great if it's in that night cream that you're putting on. The last thing to kind of keep in mind when you're reading your labels, so I just literally Googled labels and this is what comes up. And you'll find this particular ingredient, sodium lauryl sulfate. This one also has sodium lauryl sulfate. It's like one more, I think it's a hydrogen atom in it. It's the thing that's in like our soaps and our toothpaste and our shampoo that makes it all bubbly. Somehow we need things to be bubbly for us to think they clean us. So really, in and of itself, that's the only thing it does. It just makes things bubbly. It has no other properties to it. However, on the flip side, it is very irritating to some people's skin. It can actually irritate and cause further irritation. So again, if you're looking at when you pick something up, even when you go home tonight, go home, take a look through your bathroom collection. If you think about it, women probably put on about 30 different products onto our body every day. Men, about 15. You brush your teeth. You usually put some sunscreen on from time to time. You might even put on some deodorant. So there is stuff in each one of those that is going into your bodies that's affecting, again, your skin's ability to function as well as it can. And this is another one of those guys. Okay, so the wound care component of things. Once you actually have a wound, how we kind of approach and go there. Look forward to it. So this is kind of an organized approach. Anytime that I have a patient with a wound, regardless what the cause is, whether it's a surgical wound, whether it's a diabetic foot ulcer, whether it is a patient who has a wound related to scleroderma, or if they happen to have a surgical procedure totally unrelated to their scleroderma, but now they do have a wound and scleroderma is a part of the consideration for the wound healing. This is kind of the list that I'll go through. So looking at treating the cause. So why is the wound there in the first place? If I'm not on board with the rheumatologist or the patient is yet to be fully diagnosed, as we've mentioned, sometimes it can take years before you get that right diagnosis. I've, in my career, actually sent 2 patients to a rheumatologist for the examination for scleroderma because no one had ever mentioned it to them. They're like, I get these things on my fingers. And they came to see me because they keep getting these wounds on their fingers and they didn't know why. And no one was telling them why. And then I started talking to them, started explaining, or they kind of were describing the Raynaud's. I've got some heartburn, I feel tired all the time, I've got an ache here, my doctor thinks it's fibromyalgia. I was like, you need to go see a rheumatologist. And lo and behold, they came out both times in that instance. So looking at why is it there in the first place? Are they on the right medications? In some instances as well, and I'll show a picture in a second, is sometimes we need to negotiate almost care outcomes in some senses when there's a wound, because some of the ways that a wound in our skin naturally moves through that healing phase, some of the medications, as well as the scleroderma itself, kind of wreaks havoc with. So we need to sometimes discuss what the game plan is in that sense. There's the actual